Here we go. Thank you so much for the invitation to speak about this. And I think the future for leadership for the greater good in healthcare, this has been a massive issue and it's never been more relevant than we have right now. And we only need to cast our minds back to January 2020 when we were just kicking around with this potential unknown virus, that all of a sudden this has totally exploded. And we only need to look at our leaders at the moment where it's been very clear on actually what has been the things that have been really, really important, especially in healthcare. So when we start thinking about some of the leaders, we're sort of saying, well, don't think we should have said that. That may not necessarily have been helpful. What message are we trying to give to the community? What does this actually mean? So in 2020, we had this new virus come along that we had no idea what's going to happen, what's its mortality, how infectious it is, what does it mean for the community? And all of a sudden, this thing starts spreading like wildfire. People start presenting to hospitals and there's lots of anxiety and then people start dying. Even in Australia, we didn't actually have much of an issue, but then around the world, we're seeing all these things starting to manifest in front of our eyes. And then when we're seeing with our healthcare workers in the front line, especially in the second wave in the second half of last year, we're really seeing people who actually thought they were going to be working in certain environments when they started their profession end up working in a very different environment. At any point in time was leadership absolutely critically important because we actually have people who actually work in the front line, we have the community, we have everybody who just want answers and they're looking to, especially the health profession, for the definitive answers and people can't get them. We had questions around about how do we diagnose, how do we treat, how do we manage these people? What do we do on a population basis? When we're thinking of the actual government leaders, what are we going to do? Do we shut this thing down? What, we're shutting the whole community down? I cannot believe we're actually doing something like this. And even for me, when I was leading the profession of the respiratory profession, I could not believe that we were literally about to actually shut down all laboratories across the whole country. Like, just could not believe we were about to do this because at the end of the day, it was not necessarily safe. So we need to start thinking about what was happening as an individual level for the actual, as a standard person in the population, for an individual who's working in the profession, as well as an individual who's actually a potential patient, as well as overall the population and what we're going to do. Then we need to start actually understanding what the epidemiology is. We need to start understanding what prevention means. Vaccination, we already knew a certain proportion of the population just not going to have a vaccine because it's just for whatever reason is not going to happen. So what does that mean? How do we lead ourselves? What does a leader need to do to actually start thinking about all these other competing issues of what's going to be playing out in the community? And then we have the all-important managing of resources. And we had everything from managing drugs. I got rung by the chief medical officer to say we only have 3 days of drug left. What are we going to do? We had people that had things like management of PPE. We didn't have masks. What are we going to do when we know full well that the healthcare workers are potentially going to be contracting the virus or the people that they're trying to actually take care for? What are we going to do to try and prevent actually virus transmission? And so the management of the resource and the commercial aspects of this were really very important as well. However, the actual principles don't change. We have this massive pandemic that is putting the whole world in crisis, let alone the healthcare workers. But how do we lead through this? What would a leader need to do? And in my mind, the rules haven't changed. We need absolute clarity of actually the issues at hand. Half the issues that we've had, especially playing out in the media, is people tended to editorialize. So we'll have a bit of information, but then they'll put their own spin on it. So maybe all a good intention. However, their own spin was not necessarily helpful in terms of trying to get absolute clarity to empower the population or the person in front of you of a pathway out of this. We need to be really clear, and as a leader, to be what our expectations are. So, and making sure that they're ultimately realistic. And it's very important for healthcare as well. If you go to a healthcare provider, and even when I've done it fairly recently, for even as simple as when I basically dislocated my thumb, what are your expectations? What do you want to achieve where we're up to? And it's managing those expectations. And so these are really very important questions and very important things that need to be communicated as a leader of what we believe the expectations and making sure that they're realistic. Clearly, vision is going to be really important, because I think it's now very clear to us, especially in the COVID pandemic, is when the light at the end of the tunnel. But when we actually get to the end of the tunnel, what does that look like? It's not going to look like the tunnel that we entered into. So we need to have a very clear vision that we've communicated, and it's very well articulated. And we're hearing now from our leaders, especially in government-wise, what's the pathway out of this? Everyone's asking for the definitive pathway, and boy, that's hard to give, because we're actually dealing with lots of unknowns, including unknown unknowns. So the vision is really, really critical to actually get this right, and actually also understand how we might need to nuance that. Clearly, honesty and authenticity is really just so important here. We're hearing some of our leaders potentially saying things that may not be kind of correct. And so that really creates huge amount of confusion. Maybe it's been done intentionally, which is totally and utterly unacceptable, but it's also potentially maybe done in good faith, but there's a various conscious and unconscious biases that have been put there. So absolute honesty, integrity, and authenticity is really, really important. And we only need to look at some of our really good leaders at the moment when they're standing up in front of the media every day of actually saying, this is the situation and this is what we're in. Clearly, if you have this honesty and integrity and clarity, that instills trust. And it's never been a more important time that the community trusts their leaders and their healthcare professionals in particular. The last thing we need to know is that vaccination, that's just rubbish. I'm not interested in that. You have to inherently trust it. And that's us as in the healthcare areas. We are designed, we learn about this, we learn about what evidence means, and we inherently trust it. If we don't, we can't actually do anything. The other thing which is kind of interesting is this construct of do no harm. And as a leader, we need to be really careful what we're about to do, is that we need to have in the back of our minds, are we about to do harm? And there's a thing called the precautionary principle. When we don't necessarily have enough evidence, what we use is actually very much, let's just do no harm. So if we're in a situation where we need to have increased protection for PPE, for example, we had no evidence to suggest the top tier is the way to go. Well, the most precautionary way to go about it is to use the top tier, even though you didn't actually have that evidence. So we need to just keep in mind, especially as leadership in the healthcare, we can't do harm, and we need to be very careful about that. And then of all these things, especially with what we're going through at the moment, is having some insight and kindness and understanding. There's no point standing up there and just say, this is how it's going to be, especially we're going to do expectations and bad luck, this is how it's going to be. So kindness and actual insight of the implications of what we're going to do and genuinely understand it. And I think when people are following leaders, if they can truly say, yeah, I get it, that's really important. And even our chief medical officer here in Victoria mentioned some of the worst cases of the pandemic to say, yeah, I needed some support. Wow, what leadership is that, to actually have that sort of honesty to say, yeah, it's really hard, finding it really, really tough. And it's something that I've been saying when I've been saying in media, yeah, I find this really tough, like everybody else does as well. So that's sort of the COVID sort of leadership aspect of it. But I also like to use another example, where as leaders, I think it's quite okay to challenge the dogma in a very respectful way. And if we need to look at another condition that's very dear to my heart, is a condition of asthma. We know this particular condition that over 1 in 10 people have it. 90% of the people that go to hospital, it was totally avoidable. Didn't need to happen. And one of the things that it's actually quite okay for us to say to leaders, how's that okay? Is that really okay that we have that level of people who present to hospital or have an exacerbation of a condition, and we go, well, sort of best that we can do. And that's how it is. When I hear that word, that's how it's always been. Then as a leader, we can respectfully, with insight and kindness, go, well, how's that okay? Why can't we have a go at fixing this? Why can't we use a word such as, let's find a cure for asthma? Let's find a cure for intractable chronic depression. How is it okay that these conditions still exist in 2021? And I think leadership can do that. leadership in a respectful, honest, open, clarity, with insight and with evidence to say, actually, I think this is not okay. I think we can have a crack at this and let's go on for the journey. So I think what I've just talked about before, the leadership qualities in healthcare is very similar to everything else that we do. However, in the current situation in COVID, it is more than we have the spotlight on everything that we do at the moment. And it's absolutely critically important that we stick to our core values when we're actually trying to encourage and empower and bring along the community for what is going to be fundamentally a once-in-a-century social change across the whole globe. Again, thank you so much for inviting me to present. And I really look forward to hearing from anyone at any time. Thank you so much.